Yo.
What up, AJ?
What's up, brother?
Good to see you, man. Don't hit the mic. Take it easy, bro.
Sorry. Yeah, can we hear it now?
You look really nice.
Thank you.
You look like a different version of me.
Like a better looking version?
Yeah, I mean, we can ask the followers if they think you're a better version of me.
That's a little bit controversial because last time we did that, you got a little pissed off because I won.
Did you really?
The majority of the patients said that I'm better looking.
Are you sure? Guys, put it in the comments. Let us know.
Well, you said that last time.
You know mom and dad are going to pick me, so we're good.
Mom's going to pick me.
Yeah.
Dad will pick
The people that picked you were high, which takes us to the topic today.
High.
Medical marijuana.
Oh, so you're saying they were high on medical marijuana?
Yes. They went into the shop, bought themselves a joint, smoked, and then they said, AJ, it's better looking.
But is that legal, though, to go into a shop and buy one?
If you're in the state of California, if you're in Colorado, there's certain places.
Illinois,
and I think
Washington.
It's a controversial topic to really talk about this stuff. But I think it's very important to talk about the medical side of medical marijuana, why it's important, what does it treat. A lot of people have asked us for this, and I think it's an important topic to talk about.
And let's just clarify one thing here. We are not recommending that you use this. I think you should speak to your primary care physician. You should speak to a specialist. As a disclaimer, we don't recommend it, but there are certain studies that show that it's beneficial, and there's certain studies that show
the certain symptoms.
Of course. But on a state level, certain states it's legal.
Yes.
On a federal level, it is still illegal.
Yep.
Okay, perfect. So go ahead.
No, I was going to give you a little story.
Sure.
I know you don't like my stories, but I'll give it to you anyway.
Okay, how long is it though? Like
it's like 15 seconds, 20 seconds.
Okay, I'll
as long as you last. But,
go. Okay, good.
I had a patient that had MS, right? And she was on heavy narcotics. She was on fentanyl. She was on methadone. She was on all these different medications because their primary care felt that marijuana was not good for her. Mm-hmm. You know how old school doctors just are so against medical marijuana in general, right? And she asked me, she said, Dr. Jabawi, do you think I can try this? None of this stuff is working. I'm constipated. I'm dizzy all day. I'm getting addicted. I'm taking these pills. They're not working. So I did advise her. I said, you have MS. You have a reason for it. You have bad pain. You have nausea. You have all these symptoms. Go ahead and try it. Yeah. She started doing the sublingual drops.
Like drops, yeah.
Yeah, and all her symptoms improved, everything. Mm-hmm. She completely got off of opioids. She got off of everything, and she actually got like a better lifestyle from it. Mm-hmm. So there is situations where it does improve as long as you're following the guideline, right? So if I recommend 2 drops, don't do 3, 4.
Yeah, of course.
Because the hallucinogen kicks in once you go past what we recommend.
Yeah.
There's something that's called a negative feedback, right? So medical marijuana treats nausea, right? Increases your appetite and anxiety, right? So you take it, you're not nauseous, you feel less stressed, and you're eating, especially for cancer patients that can't eat, have low appetite. But there's something that's called a negative feedback. And if you overtake the THC, then it activates the things that you're supposed to actually treat. So now people tell you, right? Like, man, I did the marijuana, I hated it. I got paranoid, I got nauseous, I was losing weight. It's because you overdid it and you caused that negative feedback and it activated what it's supposed to treat.
Yeah.
So whatever that doctor recommends for you, stick by it. Don't go further. We're not doing it for you so you get high. We're treating the symptoms.
Okay.
You understand what I'm saying?
Yeah, no, I understand. And for those who don't know what MS is multiple sclerosis, just in case they need to understand. So the question here is whether it's appropriate, right, at a certain point. So like you said, it really depends on each patient. If you are a cancer patient, if you have dementia, if you have Parkinson's, pediatric convulsions or seizures, right, it absolutely helps you. But we also got to talk about the side effects of
It's important. And I feel like people always talk about the positive.
Absolutely.
Tell me about side effects.
So side effects, it really varies from each individual. First of all, there's nobody that's ever dosed on marijuana. That's probably one of the advantages of marijuana is that you don't overdose on marijuana.
They talked about it when Colorado first legalized. A lot of people were dying, but I personally have never seen it.
It depends on, if they develop like hyperemesis, right? Like a lot of them develop.
Hyperemesis gravidarum, I think. Yeah.
Well, no, gravidarum for pregnancy.
Oh, my bad. Sorry, take that back.
So in this case, these
That's
patients, and these patients have significant vomiting, dehydration, end up with kidney failure. So yes, I get that, but you don't really overdose. And another thing is some people say it's addicting. Yeah, if you use it for long term, it might be addicting, but you don't really suffer much withdrawals with medical marijuana.
But people were getting that form of that THC, what's making them puke and all of that, right? Of course,
it depends on the strain, right?
Yeah.
It depends on the strain. And of course, now there's the extract, right?
Hypercannabinoid hyperemesis, I think that's what it's called.
Sativa aspect of it, there's a sativa or an indica. The sativa is a little bit more of an upper, kind of make you feel happy. The indica is more to help you sleep and kind of calm you down. But the extract, which is like the CBD aspect, that's legal, right?
Yeah.
Because it doesn't have that hallucinogen. They use it for pain, they use it for for memory, for inflammation. So it's been helping a lot of people. But one of the side effects that's got, for example, it's very bad is impairment of, if you're driving, or memory impairment in long-term use, increased heart rate, right? Stress, anxiety. A lot of that, if you do too much of it, you'll end up having a lot of these side effects.
Yeah.
So yes, you need to be cautious on what you're using it for. And I personally, as a physician, would only recommend medical marijuana as a last resort.
Yeah.
Patients who are on chemotherapy for cancer, okay? They lose a lot of weight, lots of vomiting and nausea. It'll help them. Patients who suffer seizures, who have tried multiple medications and still suffering through seizures, it can help them, right? Patients who have trouble sleeping, depressed patients, anxiety patients, it can help. But also, if you use it too much, like you said, if you push it,
it causes negative feedback.
The negative feedback, it causes a lot of these side effects that you might be like, oh my God, I hate this. And it's not, really helping.
I don't understand why they would even do it though. So if you do it and you're puking and you're anxious, why would you do it? I don't understand that effect. I know you like it, but it's not treating anything that you want it to treat. You're doing it to treat the symptoms. You're not doing it to get high.
Yeah.
And we don't want you buying it off of some guy in the street. I told the patient,
you know what it's like.
I told the patient about medical marijuana, and she's like, "Hey, Dr. Jabawi, my neighbor knew a guy, and he went to the corner and he got me a joint, and I smoked it. And I was very paranoid." I'm like, I did not tell you to go to the guy, on the corner to buy a joint that's laced. That's not what I asked you to do.
Exactly.
So follow the guidelines, follow the recommendations, and also talk to the people that really understand medical marijuana and what it actually treats.
Yeah,
you're seeing it everywhere now.
Yeah.
But why is it that before it was so bad and now it's so good? Everybody's asking that question because you're seeing CBD, you're seeing all this hemp oil, all this stuff that's coming out. Marijuana, it's so popular now because a lot of people are going more to the natural side.
Well, a lot of, they used to use it actually in China, approximately 5,000 years ago. They used to grow this stuff and they used to use it a lot. The problem is that I think there was a lot of people that are against it a certain period of time. Now it's actually a little bit more accepted.
It wasn't acceptable.
Yeah,
my God.
Yeah, but they were against it. It was bad. It's horrible. I think a lot of it is just an opinionated, right?
It's also a lot of people's cultures just finds it as it's a horrible drug.
Yeah, because it takes you out of your element. It's the hallucinogen aspect of it.
You don't want to get to the hallucinogen part.
Yeah, but if you dose it properly, you don't have to get high.
Yeah.
Right? You can use it for a specific reason.
Especially appetite, man.
Well, that's what it is. And now let's talk about the forms, right? I personally don't recommend for anybody to smoke it. Yeah. You don't want to smoke anything, right? But it comes in pill form. It comes in vaporizer form.
Sublingual.
It comes sublingual.
Drops,
candy, right? There's edibles. There's so many different forms that you could use that's a lot healthier for you than actually smoking it, you know? But some people like the old school type, mentality, roll it up and, have fun and get high,
Like Cat Williams said, all it does is it makes you happy, sleepy, and hungry.
Yeah, those are the three side effects. Happy, hungry, sleepy. He says it's easy to get high, but it's hard to get unhigh.
Yeah. That's true too.
It was pretty funny. But yeah, it comes in powder, dry leaves. I mean, there's so many different forms that it comes in. But like I said, you need to talk to a licensed specialist who knows the medical marijuana, what they use it for, get it legally, get certified.
Don't let it affect your life. When you go to California where it's legal, it gets kind of scary. You go to Skid Row and you see all these people that are high and they have taken it to the next level. Yeah. And those are the people that make it bad. Those are the people that are setting a bad example. Yeah, but then you talk to the people that have cancer, that have gained weight, that their anxiety has been treated. The multiple sclerosis patients that have got off all the medications.
Yeah.
There's so much positive, but you do see a lot of the negative from the movies, from Hollywood.
Yeah, exactly. But they dose it right. MJ, because it's dosed right. When it's dosed right and it's medical, and it's a prescription
too, though. The medical is getting a little bit too strong, so you got to be careful.
Because a lot of people are studying it more. A lot of people are focusing on it. People are growing farms for medical marijuana. It's everywhere, right? And so people get to a certain point where they try it once. Okay, oh my God, this is great. But then all of a sudden, throughout time, you become slightly addicted to it. They do it 3-4 times a day, right? And it's really not doing anything for you.
If you don't have pain, you're not nauseous, you're not anxious, don't do it.
Don't do it.
It's unnecessary.
Absolutely.
Just do it when it's necessary. Follow the guidelines and use it for the right cause. Yeah. And don't ruin it for everybody. You know what I mean?
Another one that it really helps with is IBS or Crohn's disease, right?
Oh man!
And I had 2 patients that actually have a medical marijuana license, and that's the only thing that helped them. They take all these toxic medications from their gastroenterologist, and this one opens up their appetite, decreases their abdominal pain. So yes, there are so many things that it can help you with if you dose it properly.
And it really if you really think about the effect of it, right? So if somebody has anxiety, the anxiety causes the abdominal pain. The abdominal pain causes the nausea, right? Yeah. So if you did do the medical marijuana and your anxiety went down, now your abdominal pain is better, and now you're eating. So it kind of like a domino effect that can treat it. But then there was also a flip side to it where they started creating things that was horrible for you, like K2.
Yeah.
People were having respiratory failure. People were dying. Don't try to go down that path. Don't try to go the cheap route.
Well, see, that's my concern. Is like, how do you allow stuff like K2?
It should never be allowed.
Sold at gas stations and tobacco shops.
Anything from a gas station,
and it's a disaster, right? Yeah. But yet, good marijuana that's grown properly and tested is illegal.
Doesn't make sense. How can a gas station? Yeah, it doesn't make sense. So just do it right. If you have any of those symptoms, talk to your doctor. Find a medical marijuana clinic, talk to them about it, and be honest with yourself. Do you really need it? If you don't need it, just don't do it.
And remember, just use it as a final option. If you've exhausted your options with treatment with your primary care doctor for any disorder that we recommended, then consider marijuana if nothing else works.
100%.
So that's my recommendation. So yeah, that's medical marijuana, man.
Yeah.
You know what?
Yeah.
It's definitely such a broad topic, but I think that we can probably talk about it soon again.
We'll do it again on April 20th because that's a time where they talk about it a lot. So
420 is the holiday, supposedly. Supposedly. All right, man. Yeah. So if any questions,
you guys have questions,
yeah, go for it. If you guys have any questions, let us know. Again, thank you again, and we'll see you soon.
If you haven't subscribed, I say this every time. Please subscribe to our YouTube channel, comment, like, be involved with us, guys. The more you're involved, the better it is. Okay. We love you guys so much. Thank you guys for being so supportive since day one.
Thank you, guys.
All right.